Sure. The three main that we work on are number one, considered approach. Number two is gentle control, and number three is a touch radiant.
So a considered approach is really figuring out and gathering information about how to best approach a patient in the most calm, least confrontational way possible. And it starts before the visit. So what we do is we send out a questionnaire to you before you come into the clinic to find out more about your pet, what they like, what they dislike, in terms of touch, taste, toys, whatever that is. And we try and use that during their visit to make it a really enjoyable visit for them and as least fear, anxiety, stressful as possible. During the visit, we approach your pet in the least threatening way possible. So that involves us going very slow, looking at those cues that those pets give us. And we notice a lot of different things, in terms of their body language and their physical cues. And then we just move very slowly based on how they're accepting us with that. And then afterwards, we also keep a very detailed record. So we actually have an emotional medical record, which keeps a very detailed account of tracking their individual preferences, likes, dislikes, so that we can use that in the future as well and edit it to make it even a better experience every time that pet comes in to see us. So.
And on top of that, other doctors, so if I were to see a patient after you, I know how you rated the patient and how their experience was, what their dislikes or likes. So it sets up, again, like you said, the future visits, not just with a pet, but with a doctor's experience as well. Because I know what they like. I also know what I shouldn't do. I know how I should approach the patient. And, are they escalating or de-escalating, with our methodologies or treatments, right? So.
And we build upon that.
Right. Yep.
Yeah.
General control is that we are not WWE here anymore. Okay, I mean, we are not going to wrestle your kid. When I graduated from school, fear-free was not a thing. It was basically we will get the job done, and regardless of the fear, anxiety, and stress of the pet experiences, we will accomplish what we need to do. If that's a toenail trim, and we have to lay four people on top of the animal to get the nail trim. That's unfortunately what we did, but we no longer are doing that, and that's the whole principle of this. Sort of a slower approach, and again, trying to work within the pet what they can or cannot handle. Okay, and that even means that we use the least restraint as possible. We have some large breed dogs where we will actually steal blood out of the back leg while they're eating treats from mom or from the staff member, and versus they cannot handle it all. A front leg being drawn from, but the back one, it seems to be tolerable with a small needle. So there's all different twists, tricks, etc. on here that we use to, again, just be very gentle in our approach and slow, and again, seeing how the patient responds to us with that approach.
So really that's just getting our patients acclimated to touch. So the goal is to eliminate surprise and create predictability for them. We do that by keeping hands-on contact as much as possible during the exam, and that just might be holding on to the collar or just kind of putting a hand on their back so they know we're there. And we also use a gliding kind of transfer between body areas with our hands to assess, the patient's comfort level. So we know what's sensitive. So as I glide my hands around the belly, how are they reacting? And we look, at those body language cues that they give us, and then make adjustments and do as minimal as possible to help them through the exam in a fear-free way. So as much as we can. So.